All right. So, Aaron, I want to talk to you quickly about a couple of different things. First, when we talk about online reviews and online review management, most people equate that to being someone's written a review online. I'm
Hmm.
responding to the review, or something along those lines, right? But this process actually starts well before that. I mean, we start talking about online directories, directory listing management, things like that. But how do we start that process when we're looking at, and we hear a lot, the sole source of truth? So kind of
Hmm.
what's the process for as we think about, our online listings?
Sure. Well, it's a good point. I mean, there's reputation management and that review management that it doesn't start there. We encourage our clients to go through all of where they have a mention in a directory listing and audit it. Simply audit your Facebook profile that was created by Facebook. These platforms do health systems and physicians a number of favors. They just go and they'll
Right.
create profile. Here you go.
Right. Or the platform changes, right? Like we used to
Yeah.
have pages and that was a very succinct thing.
Hmm.
And now there are places,
Hmm.
just not just now, but
Right.
they've had places for a while. And so whether or not you actively have a page for a brick and mortar or an address, like there is a Facebook presence.
Right. There's a Facebook presence and it may or may not have accurate information. So about your business and about the physician in healthcare. So it's important. Go through and do a simple audit. Obviously, if you're a large system, that could be a big task, going through because often health systems, they may not even have their own source of truth about the locations and specialties and, phone number, addresses of all their providers. So that's a whole other topic, but
Yeah.
but it definitely relates into then auditing the online. Google My Business, we've seen so many discrepancies, whether it's spelling of names of the providers or the facility, addresses. We've seen customers who are sending ambulances to an empty field, for example,
Right.
because, the ambulance put in the address, but it was wrong on Google
Right.
My Business. So all of those things lead to having a rigorous practice of having good data hygiene, not only internal systems, but then auditing where all your places are.
Who should own that? Like who's responsible on the provider side to own that and make sure that that's up to date?
On a health system level, it typically falls in the marketing domain. Marketing is going to be owning that, kind of the 4 Ps of marketing, the places piece, placement. So that's where it is. At a smaller clinic level, it's really the provider with the practice manager working and owning that. There's various steps, at a small scale that you have to go through with some of the platforms that may require a more manual process to claim a location. For Google, for instance, you may have to go through a couple of, manual processes if you don't have a system in place to do it.
That's great. So if I'm hearing you right, go do a simple audit online,
Mhm.
starting with those kind of big consumer brands, Google, Facebook, Yelp,
Yep.
some of the healthcare specific ones, maybe Health Grades, Vitals,
Yeah,
et cetera.
absolutely. Mhm.
Understand what's there. Compare that against what you know to be the truth and what you have, and start claiming and correcting those.
Absolutely.
Is that fair?
Yep. That's you will be winning and be so much further down the road. And hopefully your patients will find you better by doing that.